Yeah, so everyone should be, joining, filing in as we speak. Welcome all. We'll start in just a few seconds. Just let everybody connect into the Zoom here. Okay. So welcome everyone to today's Berman Institute seminar. As we usually do, we'll have about 45 minutes or so presentation from today's speaker, followed by some discussion. Please feel free to write any comments or questions in the Q&A, and we'll take them as they appear. But as usual, if you're interested in making a comment verbally as well, you can just raise your hand using the hand raise function, and we'll take those in order for the discussion. So I think that's pretty much it. And without further ado, I'll just transition right into introducing our speaker for today, who's Dr. Karen Stohr. And so we're thrilled to be joined by Dr. Stohr, who is with the philosophy department at Georgetown, which she joined in 2002, and where she is the Ryan Family Professor of Metaphysics and Moral Philosophy. And in 2011, Dr. Stohr also became a senior research scholar in Georgetown's Kennedy Institute of Ethics. And prior to that, from 1999 to 2002, taught at Mount St. Mary's University in Emmitsburg, Maryland. Professor Stohr's primary research is in ethics with a focus on Aristotelian virtue ethics and Kantian ethics. She has research and teaching interest in Chinese philosophy and in bioethics, and especially in Catholic medical ethics. Her book, On Manners, was published by Routledge in 2012, and she's published a number of articles in academic journals, such as on Aristotelian practical wisdom, Kantian duties of beneficence, which is presumably somewhat related to today's talk, and the relationship between morality and manners. Which is second book, Minding the Gap, Moral Ideals and Moral Improvement, which was published by Oxford University in September 2019. She's just finished yet another book, which is wonderful, also with Oxford University, titled Choosing Freedom, A Kantian Guide to Life. And she's scheduled to be published with that book in January of 2022, which we'll hear more about, and presumably was successful in the publication of it earlier this year. It's great. So we're really, really thrilled to have you with us, Professor Stohr, today, and we're really looking forward to your talk, which is entitled When Bad Things Happen to Good Deeds, Moral Problems with Beneficence. So over to you, thanks.
Thank you, Joe, for that very kind introduction, and thanks everyone for showing up over lunch. I hope everyone is eating lunch while you're there. I'm gonna share my screen so that you can see the PowerPoint. Hopefully that's coming through, yes? Good. I'm assuming someone will tell me if it's not working. All right. Right. So the title of this talk, as you can see, is Bad Things Happening to Good Deeds, or like sort of the downsides of beneficence or moral problems with beneficence. This is a topic that I find really interesting, both on a personal level and a philosophical level. On a personal level, because obviously I mess up like everybody else when I'm trying to do things right. And on a philosophical level, because beneficence is a complicated thing to pull off, and there's a lot of different dimensions to it. And it's worth sorting through some of them to kind of see both where beneficence tends to go wrong and how we can make it go better. Okay, so first I just want to start with the obligatory, I'm working at home. These are my dogs. There's a decent chance they'll make noise or possibly bust through the door behind me. So just apologies in advance for that. They're very cute. They're just sometimes loud. Okay, back to the talk. So the organizing questions for today's talk, I'll put it this way. We know that beneficence sometimes goes wrong, and we also know there's going to be a lot of random art in this talk. We know it goes wrong, but the important question is how and why do things go wrong? And maybe most importantly at all, how can we make it go better? Or to put it in terms of the title of the talk, how can we ensure that fewer bad things happen to the good deeds that we are trying to do? So It's often, I think, helpful. I know there's some philosophers in the audience, so you probably don't need me to say this, and the rest of you probably hang out with philosophers often enough, at least to think that sometimes we're useful. But I just want to say something about how philosophy can be useful for a question like this, in part because, as folks probably know, philosophers have a habit of making things more complicated, particularly things that seem like they should be simple. We're great at making things complicated, but there's a reason for doing that too, and it's very often because things are sometimes more complicated than we think that they are. And in particular, trying to sort through some of those complications can help us see things that we couldn't have otherwise seen. So in the case of beneficence, right, we tend to focus on often in terms of intentions, right? So we might think that all that really matters for beneficence from a moral standpoint are, does the person mean well? Do they have good intentions? Probably we also care about outcomes, because when we're talking about beneficence, talking about helping people, we do care about outcomes. Did it work? Did we actually manage to provide the help that we were trying to provide? Both these things are certainly important, but I want to add something today. The thing that I'm going to add is actually going to be about how we carry out beneficence, or how we attempt to pull off the good deeds that we're doing, looking for the ways in which things can go badly there. So I'll be coming back to these in a little bit. But before I do that, I just want to draw a clarification among different ways of thinking about beneficence as a sort of a moral duty, or something that we should be doing from a moral standpoint, that's helpful sort of language. This is like sort of philosopher speak, but in a way that I think will be familiar and hopefully useful. So some instances of beneficence are helping. And I should say that I'm using beneficence because, of course, it's the sort of more technical term in medical ethics, thanks in no small part to my esteemed retired colleague, Tom Beecham. But beneficence is just sort of a stand-in here for all kinds of helping actions. So, of course, sometimes we are morally required to help people. So here are two cases in which that's true. One is when we have sort of role-based duties that are duties to help people. So this is obviously true in medicine. It's true in teaching, and a lot of other cases too, where you're doing something that is helping someone, but it's your job to do it. And so it would be wrong for you not to do that thing. It's also the case, most people think, that in the case of a genuine emergency, we're morally required to help. So if somebody is, suffering from cardiac arrest right in front of you, you should at least call 911 or do something more if you're trained, or so forth. This is pretty straightforward. There's another category of beneficence or beneficent actions that we might describe sort of clunkily, but accurately, as things that are good to do, but they're not absolutely required of us. So we tend to call these favors, or we often refer to them as favors, like somebody wants you to, drive them to the airport or whatever. It's usually not something that you have to do, but it's a nice thing to do if you can pull it off. We tend to think about charitable giving this way. Now, whether we should think about charitable giving as falling under this category as opposed to the morally required category is a matter of considerable debate among philosophers and others under the category of sort of the demandingness of beneficence, because probably a lot of the stuff that we think of as being charitable is actually stuff we should be doing as a matter of justice. I'm not going to get into that debate much at all. I just want to sort of flag it because it's something that people are often thinking of in the context of the demands of beneficence. And then sort of what people often refer to as random acts of kindness fall into this category too. So this distinction is very important for many purposes. It's actually not going to be super important for my purposes. I just want to have it out there because it does alter the shape of what beneficence is. If it's something that you have to do, you're going to be doing it no matter what. If it's something you don't have to do, but that would be nice to do, there might be reasons not to do it. And these are all going to sort of affect the way in which we approach a given act of beneficence. And then the third category, which we don't often think of, but I think does matter, is category of acts of beneficence that are morally wrong, meaning that you shouldn't do them. So one clear case is cases where you're completely incompetent to do the thing, and incompetent in a way that it means you shouldn't even try to do it. So I don't know, fixing somebody's computer when you don't know what you're doing, doing some kind of procedure that you don't know how to do, a case where you're likely to just cause more harm than good. Another category, it's actually kind of two categories, but I'm treating them together, of morally wrong beneficence are cases where the help is not wanted or where it's excessively intrusive. Now, these are complicated because, there probably are cases where you should help someone even though they don't want help because they're not in a position to express or articulate or even know what they want. So an obvious case is someone who's in a tremendous amount of pain or whose rational capacities are somehow being undermined by something, but it's complicated for reasons that people are quite familiar with, or cases where beneficence would be excessively intrusive, where like you could help, but you really shouldn't. You should just stay out because it's none of your business or because you're trying to like let your teenager learn to make their own decisions. There's lots of cases that fall into this category. I'm not going to be very concerned with the category of things that are morally wrong, because the category, the ways in which I'm interested in thinking about beneficence going badly is mostly in the context of things that are really genuinely good deeds in the sense that you should do them, or at least you have reason to do them. But the challenge is trying to sort of do them well or do them in a way that brings about the good that you're trying to bring about. Okay, so in thinking about the ways in which beneficence goes badly or good deeds go bad, the person, this will not surprise anyone probably after the introduction, but you might be sort of appalled by this, but I'm going to use Kant, Immanuel Kant here. So Kant gets a kind of bad rap, I think, within a lot of philosophy for lots, some of it's for good reasons, but one of the bad reasons is people think that he's just a very abstract ivory tower philosopher who really isn't very helpful when it comes to real practical ethical problems. So I don't think this is true of Kant. In fact, I'm confident it's not true of Kant, but I think that it's particularly not true of Kant in the case of beneficence, because Kant is actually really interesting on beneficence. And in particular, he's very insightful about the ways in which beneficence can go wrong. And so his way of thinking about beneficence and framing it for us and the ways in which we can mess up beneficence, I think are very helpful. So Kant thinks that beneficence is a moral duty. It is something we must do. Mostly he puts it in the category of good to do, but not required, although there's some caveats about that. But in general, we must be committed to beneficence, to helping people. It doesn't mean we have to help people on every occasion, but it's something that has tremendous moral value for him. But he recognizes that it's also quite complicated to pull off. And it's complicated to pull off not just because, well, we're not really sure about like how much we have to do. There's that problem, but it's complicated to pull off because of sort of features and facts about our social world and our relationships within those worlds that make it quite difficult. So there's two insights from Kant on beneficence. Well, sort of they're actually the more general insights that inform his account of beneficence that I'm going to draw on here. One of them is this: that beneficence, he thinks, presents us with a tension between respect, sort of motivations and requirements of respect, and motivations and requirements of love. I'm going to explain both of these in more depth shortly. Beneficence, he thinks, can also disrupt our sense of moral equality with other people. So these are both points about beneficence that Kant makes in the context of talking about it as a moral duty. And as we'll see, hopefully, I think they're useful for us in pinpointing some of the ways in which beneficence can go wrong. Okay, so the first one, that bit about respect and love. So Kant refers to respect and love as two great moral forces. And so here's a quote from the second part of his Metaphysics of Morals called The Doctrine of Virtue that you can see says, the principle of mutual love admonishes us constantly to come closer to one another, that of the respect we owe to one another to keep themselves at a distance from one another. So the idea here, Kant thinks, is that we have duties of respect and love, both kinds, but they pull us in different directions, or one pushes us. That we might say duties of love pull us closer to people, or they direct us to come closer to people. Duties of respect pull us away. Now, pull us away, not in a bad sense. What they do is compel us or require us to keep a certain kind of distance. And the distance that we need is the distance around what we might call somebody's agency or autonomy. So again, this is quite familiar for people well-versed in bioethics, this idea that respecting someone involves respecting their autonomy. And I've drawn this little sort of circle around the stick figure as a way of sort of expressing there's sort of a sphere or a zone where we think people are entitled to make decisions for themselves. And that's a place where respect tells us to kind of stand back and let people make their own choices, pursue their own ends, pursue their good as they see it. Now, why would we think these things are in tension with each other? Well, they're in tension because what love often pulls us to do, right, is to come inward and trying to help people, to help them achieve their ends. It tells us to sort of draw into their world. It pulls us inside their world and their circle, but in ways that can kind of threaten respect. On the other hand, if we stay sort of too far outside of somebody else's circle on the grounds of respect, we may fail with respect to love. So one way this comes out in Kant's discussion of beneficence in this quote, Kant emphasizes that the duty of beneficence is a duty to help people in accordance with their ideas of their own happiness or their ends, right? I can't benefit someone by imposing my conception of happiness on them. It has to be in accordance with their conception of happiness. And for Kant, this is just about what beneficence is. Beneficence is a duty that we owe to people in virtue of their capacity to be setters of ends, their capacity to have their own goals and projects and ends. And so beneficence has to be oriented at helping people achieve their ends as they see them. So we can already see why, for Kant, beneficence might be kind of a difficult thing to get right. Because as we all know from our own experiences, that sometimes this sort of tension between love and respect can make it really hard to figure out what to do. So an example that I like to use that I think makes this clear because it's so familiar to most of all of us probably is the example of seeing someone like a stranger or someone you don't know who's visibly upset or who seems like they're in distress of some kind or other. And then the question is, what do you do about that? So on Kant's analysis, love would draw us closer to the person, would encourage us to reach out and see if we can help them. But respect tells us to bid our distance or to keep our distance. And by that, we mean like, you don't want to be intrusive. Maybe it's none of your business. Maybe the person doesn't really feel like telling you what's going on. That tension that we experience in that moment is what Kant is describing, is the tension between these two things. And to experience it as a tension for Kant is right, because we do have duties of love toward people and we have duties of respect toward people. And sometimes it's really hard to figure out how to navigate helping actions in a way that's sufficiently loving and sufficiently respectful. Now, in the case where we encounter someone who is visibly distressed, it's usually kind of obvious to us that we have these two things going. The tension is apparent to us. But one of the things that's interesting about Kant's account of beneficence and the way that he talks about it that I think is right is that we can be sort of easily deceived by what's motivating us. And I will come back to some of this in details in just a short while. But sometimes we justify not doing anything at all in terms of respect. And sometimes we also justify pretty disrespectful forms of helping people in terms of our care or interest in their well-being. And so this tension between love and respect, Kant thinks, is frequently present, but it's not something that we're always conscious of, or at least it's something that may require some reflection on what's going on. And I emphasize this because I think this is actually one of the places in which beneficence can go wrong. When we fool ourselves sometimes about what we're doing and why, and the demands that these two moral forces place on us. Okay, so now the second of those two insights from Kant, and this is one about moral equality, more stick figures. So Kant thinks that sort of maybe the fundamental part of Kant's ethics is that we are the moral equals of every other rational being. All rational beings are moral equals. Each of us has dignity, and each of us can make claims of respect on other people in the same way. Now, this is something that is true of us no matter how we behave toward other people, but Kant recognizes that an awful lot of our behavior can and does, the wrong behavior, the bad behavior, undermines or disrupts the way this equality functions in social life. And so sometimes what we're doing is doing things that make ourselves or put ourselves in a superior position. And sometimes we're doing things that put us or other people in an inferior position. So let me start with the superior part. So Kant thinks that one of the challenges about beneficence is that it upsets this relationship of moral equality, not in fact, but in our sort of social perceptions of that. Because Kant thinks that being vulnerable and being in need puts you in a position of needing someone else's help, and that this is challenging from the standpoint of maintaining appropriate relationships of respect. Now, Kant had issues probably with being like needing help. Clearly, he was the kind of person who really hated getting help from people. It's more about Kant's moral psychology, but he seems to be onto something here in the sense that in ways that we're all familiar, one of the things that can go wrong in beneficence is that the benefactor ends up feeling superior in some way to the person that they're benefiting. And they feel superior because they're in the position to like sort of give something without needing help in response. So this is a quote here, also from the Metaphysics of Morals, from the Doctrine of Virtue. Here, Kant is actually specifically talking about beneficence in the form of financial aid. And he's criticizing rich people who give away lots of money and think that they're wonderful for it. So Kant thinks a couple of things. One, he's not even convinced that this is actually beneficence at all. It might just be what is owed to people. But even aside from that, the part I want to focus on here is the way that Kant describes the sort of the problem for the benefactor's own character, which is that helping people is fun, pleasant. Well, can be, not always, but there's a satisfaction from being the benefactor. And this isn't necessarily a bad thing in its own right, but there's moral risks involved to this, because what it might do is sort of lead the benefactor to have feelings of kind of self-satisfaction or smugness about the good they're doing in the world. So that's what he means when he's talking about reveling in moral feeling. That's supposed to be a bad thing. We're not supposed to be doing that in the sense of we're not supposed to be reveling in how wonderful we are that we've been able to come to the aid of this person, because that's going to make us feel superior to the person that we're helping. Now, on the flip side, we have the problem is that receiving beneficence is very often a situation that can make the beneficiary feel inferior. So Kant talks about this frequently in the context of gratitude, because he thinks that gratitude is a duty, but he also thinks that gratitude is hard. And you can see it in this quote as to why, because in gratitude, right, the person put under obligation stands a step lower than his benefactor. Right? And Kant says, isn't this the thing that causes ingratitude, right? Seeing someone above you and feeling resentful at not being able to make yourself fully your equal. So this, again, might just be more about Kant's psychology than anything, but the idea here is that at least some forms of helping, particularly ones that either aren't or can't be reciprocal, can upset or alter the moral relationships of equality between people. And Kant thinks that these actually need to be remedied. In fact, he has some practical suggestions for how to sort of forestall these or remedy these, including things like giving, like helping people in secret when you can. He also emphasizes the importance of things we do all the time, like you've done something, someone's like, oh, thank you. And you're like, oh, it really wasn't a big deal. Or like, oh, I really enjoy doing this kind of thing. The way that we tend to minimize the sacrifices that we've made. This is sort of ordinary politeness, but for Kant, this would also have a moral point, because it would help sort of restore or remind the two parties to the transaction of their basic moral equality. So moving on. All right, now the ways in which beneficence can go wrong, now that we have those sort of Kantian insights. Okay, so I mentioned already the fact that in beneficence, we tend to think of this as involving or focused on intentions. So almost by definition, beneficence is supposed to have good intentions. In the sense, if you're like trying to injure somebody, then it's not going to be beneficence. Even if you end up helping them by mistake, it's going to be maleficence, not beneficence. But for many people, they think that maybe that's all there is to beneficence is good intentions, that to be beneficent is just to be like trying to help people. Now, as I'll make clear, and you probably don't need much convincing, it's not clear that that's really enough, because trying to help somebody, while maybe admirable, is certainly not all there is to acting beneficently, because of course we care about outcomes as well. And outcomes matter a lot. Now, outcomes aren't always the whole deal as well, because we think too, like, it's not just that, like, when we want help from somebody, we do often mostly care about the outcome, but we do also care about intention. So if somebody like does something nice for you, but it turns out they're just doing it to impress somebody, right? Or they give money for the tax break, we do care about intentions as well as outcome when we're thinking about beneficence. So this is quite familiar, but I want to add a third part to this. And the part that I want to add is something that I'm going to call execution. Execution, as I'm thinking of it, is the way that we carry out the beneficent intention and translate it into an outcome. Now, execution is not always easy to separate from outcome in ways I'll come back to, but they can come apart. So here's an easy example. Let's suppose that you you ask your teenager to take out the trash. So imagine like it's a surly 14-year-old and the teenager does it, but like sort of grumpily in the way that teenagers are really, really good at doing, right? Whether or not this is a problem will kind of depend on what it is that you're doing. Because maybe all you want is for the trash to get taken out and you don't really care if the teenager is rolling their eyes at you as long as they take out the trash, or maybe you do care about the eye rolling because you're trying to inculcate a sense of responsibility for different kinds of household tasks. And so whether or not the execution matters will depend on our circumstances. But this is why I think it's important to separate them, is because it's possible to be like, yeah, right outcome, taking out the trash. Yeah, but you could have done better with the execution. And I think execution matters because I think actually a lot of the moral work and also the moral risks, dangers of beneficence happen at the execution stage. Now, this isn't to say that we can't always separate them, because sometimes we can't separate them. So take as an example, cheering someone up. Like if that's your goal, is to cheer somebody up and you do it really badly, your execution is failing, then you're probably going to fail in the outcome because the execution and the outcome are tied together in ways that are quite important. So we can sometimes, and sometimes we want to separate execution and outcome, and sometimes we can't separate them, but they pose distinctive kinds of moral problems. And there also are sort of different places where beneficence can go wrong. Now, let me just say something kind of briefly about culpability, which is like a stronger way of thinking responsibility. When philosophers say responsibility, we sometimes mean a bunch of different things, but culpability usually carries a connotation of blameworthiness, which is what I want to have here. When we think about culpability for beneficence when it goes wrong, right? Generally speaking, most of us would say that meaning well is not sufficient to make you non-culpable for beneficence that has gone badly. Sometimes we think people are culpable or blameworthy for bad outcomes. Not always, of course, because outcomes in particular are subject to luck in ways that are incredibly interesting and particularly interesting in medical ethics. And they're interesting both because the risk of bad luck is quite high, and it's tied to people's agency in ways that make it challenging for people not to take, not to feel themselves blameworthy for things that really are a matter of luck. But sometimes we do think people are culpable for bad outcomes in cases where they might have meant well, but it went badly and they should have known that it went badly. Like for instance, if they were completely and totally incompetent at what they were doing, then we might hold somebody culpable for a bad outcome because we think there is such a thing as negligence in setting out on a course of action that's supposed to be helping people. But I'm going to focus a bit more on culpability for what I'm calling bad execution. So here's the idea, right, is that it's possible to do something, in some sense, to mean well, in the sense that you're trying to achieve the outcome and actually achieve the outcome, but do it in a way that is like less than ideal, like the kid taking out the trash. So here are some of the ways in which you could do a beneficent action, let's just say sort of badly. And when you do these this way, it looks more like, or sort of maybe straightforwardly attached to a person's character or their character flaws. So if we think about this thing like cheering someone up badly, right? The question is, all right, you're kind of trying to cheer them up, but you're doing a terrible job of it. what we want to know here is, why are you doing a terrible job of it? And in particular, is it sort of something for which you are blameworthy or culpable, or at least something that you could change about yourself, that you're doing it badly? So people will sometimes give help in ways that, as I've said here, like grudging. It could be condescending, right? It could be careless in the sense that they're messing other things up. It could be overly confident. It could just be going too far. It could be self-centered. There's all of these ways of helping people are ways in which we are helping badly, in a sense. But they're complicated because you can't pin them down by either talking about the intention or the outcome. And this is why I think it's useful to talk about execution. Now, we are not culpable for all failures of beneficence at either the outcome or the execution stage, because it might be that the execution of it well is beyond us at a given moment. But there are places in which we could often be doing better than we are, I think. And that's the part that I'm trying to focus on. So now let me turn for the rest of the time to a case that's especially challenging, arguably one of the most difficult cases of beneficence. I don't know, there's a lot of hard cases of beneficence, but it's one that everybody is familiar with. Beneficence at the end of life. And by this, I just mean helping people who are dying. I'm just going to set aside issues about whether helping people die is part of this or not. But helping people, being beneficent toward people who are in the process of dying and helping the people around them. So what makes this challenging, I mean, it's kind of obvious that this is challenging, but it's a case where we can kind of hold the intentions, I think, constant, in the sense that most of the time people have good intentions in this situation when they're trying to help people. It's also a case, though, where the outcome is complicated, and it's complicated for tons of reasons, right? It's just very difficult for lots of reasons, to try to ensure, or do your best to make sure that people die well, for reasons that are partly medical or partly social. There's lots of reasons there, but I'm going to focus on what I'm sort of thinking about, sort of the moral obstacles to helping well here. And what makes this difficult, I think, is it's genuinely, I mean, it's really hard to do this correctly. And it's also hard because the outcome is one that we tend to resist. So it's a case where helping is necessary, but helping is difficult. It is difficult in part because the outcome is one that we tend to struggle with, most of us, on a personal level. So it's really easy to get this wrong, I think, in the sense that many of us, all of us, probably do in some way, shape, or form. But it's also obviously really important to get it right. And so that's why I want to focus on this kind of case, is because it is so important, but it also helps illustrate the many complicated ways in which beneficence can go wrong. And I will just say here, part of my thinking, actually, a lot of my thinking about beneficence in this context comes out of experience. Like most people my age, I've been involved with people's deaths at various levels, but it arose particularly in a case where I spent a lot of time helping a good friend of mine, a very close friend, as her daughter was dying of aggressive neuroblastoma. And one of the things that I did as a way of trying to help her is serve as a filter of sorts against unhelpful forms of helping, people who meant well, but who weren't able to help in the way that was actually helpful. And so it gave me a chance to think a lot about the challenges, ways in which beneficence can go wrong. And that case in particular is illustrative because it's probably one of the hardest cases of all, for reasons that I will specify in a moment. Helping people at the end of life has a lot of obstacles. Here again, I'm just going to focus on what we might describe as the things that get in the way of the execution of pulling off the beneficence well. So there's things like denial, anger, inexperience, grief, anxiety, self-deception, uncertainty. All of these make it difficult both to understand what it is that someone's trying to bring about, and then also to pull it off. Oh, fear, sorry. And all of these generate in different ways, or have the risk of generating failures of beneficence, failure to pull off the outcome that we're aiming at, no matter what our intentions are. And so these failures, some of them again are really obvious to us, but some of them are actually pretty subtle. So I'm gonna give some examples of 3 things that people commonly say to people who are dying or their family members. I've said versions of these myself. I suspect everybody has, but I think they actually all indicate one of the things that can be a failure of beneficence. So here's one. Let me know if there's something I can do. Everything happens for a reason, and you should be doing X, where X could be like, drinking more juice or doing this or, going off to this treatment. Lots of things can be filled in for X there. So how do these things get in the way of beneficence at the end of life? So this is a quote from an author, Emily Rapp, who wrote this book, The Still Point of a Turning World, about the death of her infant son from Tay-Sachs disease. So in this book, incredibly compelling and insightful book, she talks about the difficulties that other people had, particularly other parents, about interacting with her when she was caring for her son. When she says, she describes it as talking about end-of-life care for decisions, right, is tantamount to breathing fire at a dinner party or on the playground. Nobody wants to see what we see so clearly. Nobody wants to know the truth about their children, about themselves, that none of it is forever. Rapp is, I think, illustrating something that we all know, which is that one of the real challenges of beneficence when it comes to dying, particularly when it comes to dying children, is that the outcome is one that is incredibly difficult for anyone to face. And facing that outcome, helping people with beneficence, requires that one sort of accept the possibility of something that one doesn't want to accept. It's basically entering into somebody else's nightmare. And for lots of reasons, none of us want to do that. And it's hard to do well for reasons, again, I'll come back to. But let me now use a different quote from Nicholas Wolterstorff, who's a theologian whose son died in a mountain climbing accident. So Wolterstorff, in this really gorgeous book, Lament for a Son, emphasizes what for him, the experience of people telling him that his situation or his grief isn't so bad, right? He says, don't say it's not really so bad, because it is. Death is awful, demonic. If you think your task as comforter is to tell me that really, all things considered, it's not so bad, you do not sit with me in my grief, but place yourself off in the distance away from me. So Wolterstorff, I think, highlights one of the sort of, in both these cases, in Rapp and Wolterstorff, we have a kind of distancing from people that people might construe as actually a way of helping, but in fact, it's not. That ways of sort of separating oneself off from what the other is going through is actually a self-protective mechanism, not something that's actually conducive to beneficence. So I'm going to switch gears briefly, switch philosophers briefly, and refer to Aristotle for a minute. So those of you who are familiar with Aristotle may know that there's a virtue that's at the center of his thinking about ethics. And the virtue is called practical wisdom, or Greek is phronesis. So this is a hard virtue to pin down, but it serves an enormously important role in Aristotle's ethics. But the basic idea for practical wisdom is that it's sort of a conglomeration of what we might call skills and habits and dispositions. The person who is practically wise is the person who knows what to do in any given situation. And this sounds really kind of loose and opaque, but there's a lot to this. And in the case of something like people dying, well, we know, mostly because most of us are familiar with a few people like this, maybe like an amazing hospice nurse or social worker or someone else who does know what to do, who knows what things are needed, what skills, and this is, again, certainly a matter of skill, but also a matter of disposition, a matter of sort of sensitivity to the nuances of what's happening. And in Aristotelian terms, we might say that this sort of conglomeration of capacities, right, is essential for genuinely helpful helping, to prevent beneficence from going wrong in ways that are familiar to us from personal experience, and that we can articulate in terms of the things that interfere with people's capacities to come close properly. Oh, yeah, I'll go ahead and do this. So I want to, in the last few minutes here, put forward three, what we might call, I wouldn't actually call them virtues. I don't know if they lend themselves to that, but like maybe three traits or characters that are important for becoming better at beneficence, whose importance is very salient, I think, in some of these end-of-life situations. And I'm going to come back to those quotes that I was mentioning before. So the first of these is imagination. So I said that this, which I've said more times than I can count, and we all say in different ways, can be a way in which beneficence can fail. And this, I think, fails in part because it can often show a lack of imagination or a lack of effort for imagination. So this statement is frequently motivated by genuine considerations of respect, right? People don't want to just like go in and do something. They want to know, they want to like, be, you know, like, okay, I want to help, but I don't really know how. So let me know if there's something I can do. And they're perfectly willing to go do the thing that somebody else instructs them to do. But for people who, which is probably everybody who have experience with this, this is actually very often a very burdensome request, because very often the person in need of help has no idea what they need other people to do. And so while this could like express respect, it also has the effect of shifting the burden to the other person, the person who is suffering, to figure out what it is that they need and then ask for help. And we've already seen, remember that Kant's points about moral equality suggest that it's hard to ask for help, right? We all know this too, that it can be difficult. And so in some ways, this statement can actually burden the person you're trying to help more, because then it's on them to both figure out what they need and then ask for what it is that they need. It can also sometimes just be lazy, in the sense that part of the task of helping people who are suffering is to try to imagine the possible things that you might be able to do that would be genuinely helpful to them. So we're all familiar with this too, like the people, I remember being struck at one point in my life by the wisdom of people who just like show up with food and drinks and stuff like that and put them in a refrigerator and leave. You know, that kind of help, imaginative ways of thinking through what a person's situation might be and what they actually might need. So I might think of like canvassing what the possibilities are and dreaming up new ones. Second one, pretty familiar too, humility. So this one, the thing, this is probably more obvious what goes wrong with this. People who say, you should be doing this. So it's common when people are faced with somebody else is dying, that they want to engage in what Joan Didion sort of famously calls a kind of magical thinking. Like, how can I be sure that this won't happen to me? And this comes out in a lot of different ways. But one of the ways in which it comes out is a way of saying like, okay, you should be doing this, right? This thing, I read about this thing in the paper or the study, or I've heard that, you know, if you just do this, there's a bunch of things about this. One, like there's a good chance you're just wrong about the value of this. There's also a presupposition often that the person hasn't thought about this. And maybe more subtly, but no less importantly, there are also ways in which this can undermine a person's conception of their own agency and their own capacities. I think this is particularly true when it comes to parents trying to care for seriously ill children, which has to be one of the most difficult things a parent could ever be asked to do. And parents in that situation have all kinds of reasons for already fearing that they're failing at their job. And in many ways, this just exacerbates this, right? Like, oh, if you were only doing this, or you've done this, this wouldn't have happened. Or it could be like, if you're doing this, you could be doing better. And so this can be a way of subtly, looks like it's helping, but actually it can often be a way of just being annoying, but also subtly undermining someone's agency in what it is that they're doing, which is not to say that offering suggestions is never useful. The challenge, of course, is figuring out whether or not you actually have the relevant expertise, and also whether or not offering this particular bit of advice at a given moment is actually beneficial to the person. Most of the time, it isn't. The last one, which I actually referenced a little bit before, what I'm calling kind of a decentering of the self. So everything happens for a reason. Familiar phrase. That's a secular version. The religious version of this is like, God has a plan. This is something that lots of people find comforting. It is also something that lots of people don't find comforting, even if they're theists. Obviously, an atheist isn't going to find it very comforting to think that God has a plan, but even theists can find God has a plan language very difficult or very undermining, in part because it doesn't always seem like a very good reason. C.S. Lewis, in his really gorgeous book, A Grief Observed, Lewis was, apart from writing the Chronicles of Narnia, was also a theologian, and talked about his anger at people who would tell him when his wife was dying a terribly painful death of cancer, but like, this is, oh, she's in God, or after she died, that she's in God's hands. And he's like, I don't actually find that super comforting. And the reason I'm pinpointing this and attaching to decentering the self is because I think often what happens that when people are seeking to comfort or benefit people who are suffering, what they're actually doing is trying to seek to benefit or comfort themselves. And that this is a way of sort of assuring themselves that the universe is right and that things are fine when they're not. And Walter Stohr's quote, which I mentioned before, is a way of trying to articulate this, that when people diminish the suffering, what they're doing is comforting themselves, not the other. So back to Walter Stohr to close out here. This line about sort of come sit beside me on my mourning bench, the idea that what we're after in the case of beneficence, especially in beneficence in hard cases, we might put in Kantian terms as a kind of respectful closeness, that to sit next to someone on their mourning bench is to be close to them, but close to them in a way that doesn't try to diminish or reshape their experiences, that still allows their sufferings to be theirs while sharing in those sufferings. And this is very hard to pull off, as we know from experience, but this having this as the aim is what it is that we're trying to do when we're being beneficent and helping people, particularly in these hard cases, is helpful because it articulates these sort of two ideals, trying to be near enough to people suffering that we can share in it, but not so near that we take it and try to reshape it in ways that diminish it and diminish them in the process. So it's not really surprising that beneficence is so hard, especially in these hard cases, we know this, but I think that there's a value in trying to unpack what we're trying to do with beneficence so that we can see more clearly how it's going wrong and also how we can do it better, which in the end is the goal. Okay. So thank you. I'm looking forward to questions. My dogs managed to stay silent. I hope that will last. That's all. Thanks.
Thanks so much, Karen. And we had some notes in the Q&A. First from Mariah saying your dogs are so adorable, and also thank you for that. Great. So let me just take some of the questions as they emerge here in the chat or Q&A. And as I mentioned earlier, if anyone would like to speak your question, you're welcome to just press the raise hand button. I know sometimes it's easier to do that. So we have one question here, which is asking about adding the epistemic virtue of truthfulness to the interpersonal virtue of respectful closeness. I'm not sure if there's enough there for you to, or Mariah, you raised your hand. Would you like to say more about that? Maybe engage in a bit of a discussion here. Let me allow you to talk, Mariah, if you're able to.
Mm-hmm. Oh, okay, great. Hi, Karen.
Hi, Mariah.
Wonderful talk. Yeah, so I mean, I love everything that you were speaking about here, and I was just thinking about the experience of a person who might want to comfort somebody who's going through a terrible loss or sadness, and failing to execute it because they're not like I'll just say we instead of they, because we're not able necessarily to confront the full agony of the truth. In that, like, there's some practice of truthfulness in the sense of being willing to sit with real things that are almost, or not even almost, that are unbearable. Like, to me, that's I think potentially not only an interpersonal virtue, but also an epistemic virtue, and it might potentially be added to those list of qualities that you had there.
Yeah, that's a great question, and definitely a big one. I mean, all right, so I have, I'm largely Kantian, so I'm a fan of truthfulness, but I think you're absolutely right? That the truthfulness, one of the things that's interesting about Kant's emphasis on truthfulness is that he talks a lot about self-deception. And I mean, self-deception is super interesting, right? Because it's psychologically kind of useful. It has value in terms of our mental health and well-being in a variety of ways. But it can also go badly, I think, in the sense that being truthful about oneself. I mean, I think I was in my sort of vague talk about decentering of the self. I think part of that is sort of being cognizant of what your own psychology is or what your own motivations are, which I think is partly about being truthful about yourself. Like, I find this incredibly painful, or I find this traumatic. And this is not always like character flaws. I mean, it can be traumatic to go through somebody's, or to sort of benefit a friend because it brings up things of your own, right? Past parts of your own. Like there's a lot of reasons why people find it incredibly difficult to face up to other people's suffering that don't necessarily all point to character flaws. But truthfulness, it seems like, has got to be at the heart of it, particularly with regard to oneself and one's own motivations. Because I do think that often the sort of the attempts at comfort of other people are very often ways of trying to comfort ourselves. And it might be that that's the best we could do, but it's important to be truthful, I think, about our own failings. Like, this is more about me than it is about the other person, because that is one of the biggest barriers to helping people, is, I think, being able to face up to the reality of their situation. But having said that, it's complicated too, right? Because part of helping someone who is suffering is being present to where they are, right? And so people who are, for instance, trying to hang on to a shred of hope may need to engage in some kind of deception about, like, they don't need their friends to be like, actually, this is not going to work. That isn't always helpful either. And so I think that trying to understand the role that truthfulness plays in interpersonal relationships is really important to getting beneficence right too. So yes, I'm a fan of truthfulness with lots of complicated nuances, particularly about oneself.
Thank you.
Thanks, Mariah. If I could just follow it up quickly before you go to the next question, I was wondering about what clinicians should make of this, and more generally thinking about how the one's ability to be beneficent to others sometimes moderates one's beneficence to the person in front of a clinician, for example. So if one were to be wholeheartedly sort of fully involved and beneficent with a patient, then that might mean that other patients may not have the benefit of that, of your willingness to do that, potentially, if you're a busy person. And just wondering what your thoughts are about the distribution of fair, sort of equitable distribution of capacity when it comes to somebody like that who has a lot of potential. How I'm not sure I have a fully fleshed out question, but how does that relate to this? Yeah.
So I've actually thought about this a fair bit, but I don't know how constructively, not being a clinician. I just have friends who are clinicians, and a kind of odd how difficult that job can sometimes be, particularly if you think about, like, say, being a pediatric oncologist or something, where it's just an incredibly draining job. But thinking about this in terms of, like, what distance is required and for what purposes, right? So clearly a clinician plays a different role vis-a-vis a patient than a friend or a family member does, because it's the clinician's job, well, A, to be truthful, but also to be able to maintain the distance that's possible for them to treat the patient well, but also function in the rest of their lives, right? Like, go to the next patient, like, be able to leave the room, do the work, go home, and, like, take seriously your own kids, your infection, or whatever it is. All of those things from a psychological standpoint, there's questions about what does the clinician need to do in order to function well, in order to do the job well. And I think that is different. I mean, the sense that I can't imagine not being a clinician and not having a capacity to maintain distance that might not be appropriate in a friend. But I think that's partly the role specific things. On the other hand, everybody is familiar with clinicians who take that distance too seriously or go too far, and who aren't. And the best clinicians obviously can manage to pull off both, but that is unbelievably hard. And I'm just in awe of clinicians who pull that off.
Thanks. David, you're able to unmute if you'd like to ask your question.
I think I just did. Can you hear me?
Yep.
Mm-hmm.
Okay. This is a very interesting discussion, Karen. And I have to say, it's very thought-provoking, and I'm not sure I'm coming away with any answers about how to behave going forward. And to be honest, I'm a clinician and an emergency doc for 40 years of practice, but also encounter these situations in daily life, including something fairly recent with one of my medical school classmates who's just received a diagnosis of metastatic, a very rare cancer for which there's no good treatment. And so I've been navigating these issues that you raised for many years in many settings. And I guess in the end, I'm looking at this as beneficence. We see as actors to help us determine what actions we should be taking. And it's very difficult, if not impossible, to know how the receiver of those actions is ultimately going to acknowledge them, whether they turn out to be beneficial or of good or not. And even trying to imagine somebody else's predicament there's no assurance that you're going to imagine options that do turn out to be beneficent. So, I was struck by your criticisms of let me know if there's anything I can do to help. And that's one of the things I've been navigating with my classmate right now, because he lives, 1,000 miles away. So I guess I'm just repeating myself, but to say it's very thought-provoking, but I'm still left with this thing. Can you ever fully comprehend how your actions will be perceived by the recipient? And in the end, you just hope you can do the right thing and not be maleficent by their perception in the end.
Yeah, that's a really interesting question, because you're right. And I didn't actually emphasize this enough, is that some of the imagination and the humility can be at cross purposes, because the challenge, right, is that we're often bad at imagining things. So this is like incredibly obvious in the case of interacting with people with disabilities, because people who don't have those or aren't familiar with that disability are often really, really bad at imagining what life is like for someone who has that. And so we'll generally often do a terrible job of helping people. And so people with disabilities are obviously often the recipients of deeply unhelpful beneficence by people who think they're being helpful, but they're just wrong. And part of that wrong is that it's a failure of imagination. But it's also, I think, not just a failure of imagination, because it's a failure of imagination tied with a lack of humility. There's an assumption like, I totally have this. I know what's going on here. I know what's wrong. And that is something that clearly a tendency that we have to rein in. And it's hard for people who are doers. Like, so you can imagine like two things. There's the person who wants to like jump in and swoop in and do everything, and we'll get it wrong because they're not attending enough to what the person actually needs. And then the opposite is the person who's like, freezes and like doesn't do anything at all. And these two types of people are common. They're sort of common actors in the end of life scenario. None of us want to be either of those, but trying to figure out where the balance is, like trying to figure out, if I don't really know what the person needs, how is it that I can help? And how can I do it in a way that isn't further burdening? And I don't have any like brilliant advice for this, except for some of the practical things that we all learn from experience, right? Filtering things through friends or people so the person doesn't get 12,000 text messages, offering specific suggestions. Like there's definitely practical techniques there, figuring out what we're actually good at doing and what we're not good at doing, also important. But it's very hard. And this is the point of, I think, introducing Aristotelian practical wisdom, because I mean, Aristotle's like, yeah, this is a super hard virtue. And it's something that you can acquire only through experience. And I do actually think that experience matters here. This is why like an incredibly wise hospice nurse or social worker is an amazing person. And it's in part because of their skills that they've acquired over time. And then they know like, yes, this is what people are likely to need. But it is hard. And I sympathize. I'm sorry about your friend.
Thank you.
Thanks, David. While we're waiting on more questions to come in, yeah, maybe just if you had any thoughts on the intersection of sort of culture and beneficence and the way you're thinking about it, be interested to hear whether, some of the causes of failed execution are for sort of failing to know well enough, how an individual perceives the harm of the situation they're in, or how they might respond to it within their cultural context or other things like that. So I'm just curious, like where that fits into the mix here. Yeah.
Well, I think the God has a plan thing fits into that nicely, because I mean, this is something that actually lots of people find genuinely comforting, right? But also lots of people don't. And how can you know? And maybe it's the same person finds it like comforting one day and not the other day. And so there's got to be a lot of obviously like leeway for people to mess up. And because beneficence is so hard to get right? There's a lot of well-meant beneficence that goes wrong. My interest is in trying to articulate the things in which we could be doing better, because I think we often fail to do chaplain. I see this quote too. Yeah, chaplains, of course. Yes, I didn't mean to leave out chaplains there. Most definitely. What are the places in which we can do it better? Sometimes we just can't for reasons that aren't our fault or that we can't change. But I think very often we can do beneficence better than we do. And so I think there is an obligation in a case where beneficence is required of us to think through, not just like the outcome and not to rush sort of headway into it, but to think both about what the person actually needs and what obstacles we know are likely to be in our way when it comes to helping them well. And so maybe it's just like a call for reflection in a sense, careful reflection on our own capacities and our own limits, as well as the needs of somebody else. But there's going to be cases where we have no idea, right? And then maybe the answer is just, show up with, a lot of soda or something, or some meals, right? Which is straightforward.
Yeah. Well, we have just a minute left. Maybe if I could ask one more question from the group, from the audience here. It's a question about the relationship between love and respect, and the difference between the two. So Kant describes the difference clearly, but the question is, do you believe that respect and love are really that different? It's in this questioner asks, it seems that the type of love that pulls in the opposite direction of respect is a selfish love, whereas a selfless love might be the same as respect, if respect were better defined. So something about, that relationship.
Yeah. So Kant describes beneficence as a duty of love, but in some ways it's actually all duties of respect, because love is a way of respecting someone in a way that doesn't make it sound very like warm and fuzzy, but that's Kant for you. But yeah, so much of it, when love is unbounded by respect, it's not right. It's not the right kind of love for Kant. That is expression. I think it's often selfishness. It could be a lot of different things. It could be like self-conceit or arrogance, things that look like love on the surface but aren't. So I think Kant would agree that sort of a proper love is love that maintains some kind of boundary, in a sense, that is based in respect for the person as an agent and their choices in ways that shape everything that you do as a matter of love. So there's only so close you come. Maybe that's a way of putting it.
Yeah. Well, great. Well, I think with that, we'll have to close for today. But thank you again, Professor Stohr, for joining us, and for the really, as someone put in the chat here, very helpful combination of theory and practice. So thank you again. And thank you all for joining.
Thanks to all of you. I hope everyone has a good afternoon now that it's finally not raining.
Yeah.
Yay.